These next activities would begin in phase 2, where we would want to increase the range of motion in the patient. For this activity, it would be inside of the pool, but I will demonstrate what the movements would be on dry land. The purpose of using aquatic therapy in patients who don't have that range of motion yet is that we can begin strengthening inside the pool without the patient having the complete range of motion. Stretching exercises, we would want the patient to, so if the water comes up to here, we would want the patient to do different ranges of motion up to where the water encompasses, whether that's flexion, extension, abduction, and all the planes. From there, we can eventually progress this to have a pool noodle, and then they would be able to push it down, push it sideways, and then that would begin their strengthening. And an objective measure we could take for this would be shoulder ranges of motion before and after to see if the aquatic therapy is benefiting the patient.
So for our patient, we're going to be doing a joint mobilization. We want to increase extension, external rotation, and abduction. So we'll be doing a posterior to anterior humeral joint. Before we start, we're going to take a goniometric measurement to see what her range of motion is like beforehand. And then we'll have her lie prone with a bolster underneath her clavicle to stabilize the scapula. And then we will have our patient into a safe please pack position. And then we perform posterior to anterior glide 1 to 2 oscillations for 20 to 30 seconds at a grade 3 or grade 4 mobilization. Once those 20 to 30 seconds are up, we will reassess and take another goniometric measurement to see if range of motion has been increased.
So I'm going to be demonstrating how to perform I's, T's, and Y's exercises for external rotator. In order to assess before and after, I'm going to be doing a manual muscle test on Dustin's external rotators, stabilizing the shoulder, and we're going to go all the way up, 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 up. Good, and come back down. Do it one more time. Up, 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 up. Good, relax, and then come down about halfway. Good, and then don't let me push you down. This will be our break test. We'll hold for about 30 seconds. Relax. This, I would rate it as a 4 out of 5 strength. So I'm going to ask Dustin to get into his position for the I's, T's, and Y's. And then the I's will be performed in a shoulder flexion movement. So he'll come up all into shoulder flexion and come down. And he will stop right before we lose resistance. But good. We'll do that about 10 times. Then we're going to go for our T's, which is just shoulder abduction. So come straight out. Good. And then come down right before we lose resistance. Good. We're going to also do that for 10 times. The last one's going to be shoulder extension. So come all the way back, Dustin. And come down up until we're about to lose resistance. Up. And then we'll do that also for 10 repetitions. Good. Relax. Or after he performs the exercises, I'll be doing another manual muscle test to assess his strength afterwards. And gonna go through the whole motion all the way up, 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 up. Good, and relax. Do it one more time. Good, and then come halfway. Good, and don't let me push you down. Hold it for 30 seconds. Good, relax. Dustin is still a 4 out of 5, so this will be an exercise we will continuously do throughout his rehabilitation.